this module, we will guide you through the correct procedure to conduct the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test using a fingerstick blood sample. The test is designed to deliver results in as little as 60 seconds, but every step must be followed meticulously to ensure accuracy, safety, and compliance with the manufacturer's instructions. We will cover everything you need to know, from gathering materials to interpreting results correctly. Let's get started. Before beginning the test, gather all the necessary materials. You will need an alcohol swab, a single-use lancet, a capillary pipette, one sealed test pouch containing the INSTI membrane unit, and one vial of each of the sample diluent, colour developer, and clarifying solution. Verify that the test kit has been stored correctly at the recommended temperature range of 15 to 30 degrees Celsius, which is 59 to 86 degrees Fahrenheit, to maintain its integrity and effectiveness. Always start by putting on gloves to maintain a sterile environment and protect yourself from exposure to blood-borne pathogens. Inspect the gloves for any tears or defects before proceeding. Wearing gloves and adhering to hand hygiene protocols are critical steps in maintaining safety and preventing contamination during the testing process. To ensure an adequate blood sample, position the patient's hand at waist level or lower, with the palm facing upwards on a flat surface like a table. This positioning facilitates blood flow to the fingertip, making the blood collection process easier and more effective. Massage the finger gently to move the blood towards the fingertip. You should see the fingertip become pink as blood flow increases. If the patient's hand is cold, use a heating pad if available to warm the hand, as this can significantly improve blood flow, especially in individuals with poor circulation. Next, clean the fingertip with the alcohol swab to thoroughly remove any contaminants. Wipe the area well and ensure that the alcohol dries completely before proceeding, as residual alcohol can dilute the blood sample and interfere with the accuracy of the test. Once the finger is dry, twist and remove the protective insert from the lancet. Firmly press the area just below where the lancet will be applied to ensure good blood flow. Position the lancet on the side of the fingertip and press firmly until you hear a click. Immediately dispose of the used lancet in a proper sharps container to maintain safety and prevent needle stick injuries. As a blood droplet forms, hold the pipette horizontally and touch the tip of the pipette to the blood drop. The pipette will automatically draw the blood to the fill line by capillary action. Do not squeeze the pipette bulb while sampling, as this can cause incorrect sample volume and affect test results. If only a small amount of blood trickles out, gently apply intermittent pressure below the puncture site to obtain the required blood volume. If the blood volume remains inadequate, perform a second skin puncture using a new lancet. Immediately transfer the blood sample held in the pipette to solution number 1 without delay to prevent clotting. Align the tip of the pipette with the solution number 1 vial and gently squeeze the bulb to dispense the sample into the vial. If the sample does not expel easily, hold the pipette vertically and cover the vent hole with your finger without pressing, then squeeze the bulb to release the sample. Recap the vial securely and mix by gently inverting it 2 to 3 times to ensure the blood and diluent are fully combined. Now, carefully tear open the pouch containing the INSTI membrane unit. making sure not to touch the centre well of the membrane, as this can cause contamination. Place the membrane unit on a flat, level surface. For sample identification purposes, you may label the bottom tab of the membrane unit with the patient's name or identification number. Pour the entire contents of the sample diluent specimen mixture into the centre of the membrane unit well within 5 minutes of adding the blood to the solution 1 vial. It is crucial to perform this step promptly to maintain the integrity of the sample. The mixture should absorb through the membrane in less than 60 seconds. However, absorption times may vary slightly depending on the sample type. Next, resuspend the solution 2 vial by slowly inverting the bottle 2 to 3 times until the reagent is evenly suspended. Open the solution 2 vial and add the entire contents to the centre of the membrane unit well. The coloured solution should flow through the membrane completely in about 20 seconds, allowing the test and control dots to develop clearly. Once solution 2 has absorbed, take the solution 3 vial and add the entire contents to the centre of the membrane unit well. This solution will lighten the background colour, facilitating the reading of results. Make sure the solution 3 is fully absorbed before attempting to interpret the results. Immediately read the results while the membrane is still wet to ensure accuracy. Do not read the results if more than 5 minutes has elapsed following the addition of solution 3, as this can lead to inaccurate interpretations. It is important to read the results under adequate lighting conditions. On the membrane, the control dot will appear at the top and confirms that the test has run correctly. The HIV test dot is located at the bottom and the syphilis test dot on the left-hand side of the membrane. A non-reactive result will show only the control dot, indicating no antibodies to HIV-1, HIV-2 or syphilis were detected in the specimen. A reactive result will display 2 or 3 blue dots discernible above any background tint, indicating the presence of HIV-1, HIV-2 and/or syphilis antibodies depending on the dot positions. Each dot's presence corresponds to a specific test spot. HIV is at the bottom and syphilis is on the left side. If the control dot does not appear, the test is invalid and you must repeat the test using a new kit. Never interpret or use invalid results. The INSTI Multiplex test includes a built-in IgG and IgM capture procedural control, represented by the control dot to demonstrate assay validity and proper sample addition. A blue colour on the control dot indicates that the proper specimen was added and that the assay procedure was executed correctly. There are separate controls available for syphilis and HIV to verify the test performance and the interpretation of results. Kit controls should be run under the following circumstances: for a new operator verification, when switching to a new lot number, when receiving a new shipment of INSTI kits, if storage or testing temperatures fall outside of the recommended 15 to 30 degrees Celsius range, or at regular intervals as determined by your facility's protocols. Ensure to follow the instructions for use provided with the INSTI syphilis test controls and the INSTI HIV-1, HIV-2 test controls for detailed guidance on handling and interpreting control results. Do not use external controls that have not been validated for the INSTI Multiplex test, as these may not produce the expected results and can compromise test reliability. After completing the test, dispose of all used components, including gloves, lancets, pipettes and membrane units, in a designated biohazard container. Proper disposal is essential for maintaining a safe and sterile testing environment and preventing contamination. Ensure that biohazard containers are sealed and stored correctly until collected for disposal by a certified biohazard waste service. Clean your workstation thoroughly after testing to maintain a sterile environment for future tests and to uphold the highest standards of laboratory safety. To summarise, conducting the INSTI Multiplex test involves several critical steps: preparing the blood sample and transferring it to the solution 1 vial, running the test on the membrane unit by adding the solution 1 specimen mixture, then solution 2 and then solution 3, finally reading the results immediately while the membrane is still wet, and safely disposing of all used components. Adhering closely to each step is crucial for ensuring the accuracy and reliability of your test result. Congratulations on completing Module 3. You now have a detailed understanding of how to correctly perform the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. In the next module, we'll cover troubleshooting tips and how to handle common issues that may arise during testing. Thank you for your attention, and I look forward to guiding you through the next steps.